My name is Sam. I'm a physician assistant, IMS ENT. I've been practicing medicine for over 10.5 years in the Phoenix area. I am a lifelong allergy and sinus sufferer, so it's always been my desire to help other people that have had these afflictions. My whole life I've always had one infection after another, sinus infections, ear infections, one antibiotic after another antibiotic. It seemed that just when I was finished with one, I would start another one. Nothing seemed to make it better or offer any long-term promise. And I was just resolved to the fact that although I tried every new treatment, that I was just going to be stuck feeling this way for the rest of my life. A normal night for me, I would get up at least 4 times a night to either take something for headache or pain or to actually flush my sinuses because I could not breathe. I could never take a breath with my mouth closed. I was always congested, always had difficulty breathing. Would sometimes have a headache for 3 or 4 months at a time. Every time they would take a CT or any kind of imaging, they would just come back and say that everything that they could see, was blocked, and my only alternative was to have repeated series of sinus surgeries, which they didn't hold hope that that was really going to be helpful for me. My quality of life was drastically affected by the sinus symptoms that I had. To go on vacation someplace and even spend the night in a hotel, I would sit there and think about, well, I'm not going to sleep, even less than I would at home. I've got to take all these things to flush my nose. I didn't feel like going out with family and friends because I always felt fatigued and run down. And I had to take along a truckload of Kleenexes every place I went. You're self-conscious because you think everybody's looking at you, always blowing your nose, and you just never feel your best. There was some times when I was in medical school that I had to take a week or so off because I couldn't even get out of bed because the headaches were so bad and the infection was so bad, and they had done 3 or 4 rounds of antibiotics, steroids, and everything that they could come up with just to try to get me so that I could walk across the room and not feel like my head was going to explode. And that was a recurrent theme, that I suffered through most of my adult life, and I knew that even during allergy season that was going to get worse. I went to a lot of specialists, ENTs, asthma allergy specialists. They presented the option of surgery, but because my disease was so advanced, they never could come upon an agreement on, even what to try, and they weren't very convincing that it would work. So they kept trying, the newest drug that came out, the newest nasal spray, the newest sinus wash, the newest antibiotic, anything that they could come up with to get the insurance company to agree, or even out of pocket, just to try to get some relief. None of the options seemed to make any difference. I didn't want general anesthesia, so I was always searching for an option that could get me some relief without taking that route. When I started working at IMS ENT, I started noticing the balloon sinuplasty patients. They were me. They were how I had lived my life. They were miserable all the time. Tried every medication. And I saw the fantastic, almost unreal results they were getting. They were going from being miserable all the time to saying, I wish I could have done this 20 years ago. And I thought, well, if it works for them, surely it would work for me. And so that was what led me down that road, realizing that there was at last an option that could improve the quality of my life. I expected there to be some pain with the in-office procedure. I was pleasantly surprised. I was able to watch the entire thing on the screen and didn't experience any pain at all. I had no discomfort. What I would tell other patients that are suffering from chronic sinusitis is there's finally an answer to their prayers. This procedure, which is done in the office with no long recovery time, no severe pain, provides such a change to your life, and you owe it to yourself to give it a try. I can now sleep all the way through the night. I still do my sinus medications, but I often forget because I don't have the symptoms anymore. I have energy that I didn't have before. I can go out with family and friends, enjoy myself. I no longer have a stock in Kleenex and carry Kleenex with me every place I go. It has just changed everything about how I live. Well, Sinuplasty has changed my life. I'd recommend it to other sinus sufferers, especially those people that feel that there were no other options for them. They didn't want to do general anesthesia, and they felt they were just going to have to suffer with this. This may be their answer.